Morning. Is everyone good to go? Yep. So we have 3 new cases of COVID-19 in Queensland overnight. 2 of those overseas acquired and detected in hotel quarantine. 1 locally acquired, 1 new case, flight attendant who we think was possibly infectious from the 11th of July. She crewed 6 flights during that period between Brisbane, Longreach, Gladstone and Hervey Bay. The Chief Health Officer and the Health Minister will outline the details of those flights. It is absolutely urgent that we get every passenger on those flights tested as soon as possible. Queensland Health is standing up testing capacity in those locations. Minister Glenn Butcher was on one of the flights between Brisbane and Gladstone. He has been tested and is in home quarantine. Given this is some time ago, if we can get all of the passengers tested, that will give a picture of whether there is a greater risk here than we're currently aware of. There may be more contact locations during the day as health and police continue to talk to the person involved. For the first time, we've had, the first time recently, positive sewage test results in Byron Bay. This has just recently come to hand. New South Wales is not yet aware of any cases in Byron Bay, but clearly given the fact that Byron is within the border zone that we announced yesterday and implemented overnight, we'll be monitoring that very, very closely. It just underlines how critical it is that people in that border zone only travel for those essential reasons that were outlined. What's at stake is the border zone itself. If we can't keep the border zone safe, then we won't be able to keep those arrangements in place and people won't be able to move. And so it's really important that they only move for those essential purposes.
So 1 new community acquired case in the last 24 hours, and this is a woman in her 30s who lives in Banyo. She's a flight attendant and works for the regional Qantas routes, and she came forward and got tested on the 21st of July. Her symptoms started on the 13th of July, so we're deeming her infectious period back to the 11th of July. So she crewed 6 flights on the 11th and 12th of July, and is critical that anyone who is on any of those flights immediately comes forward and gets tested. So we've got the manifests and we're rapidly going through them, but please, if anyone's been on those flights, please come forward. So I'm going to read out the flights. On the 11th of July, Brisbane Longreach, Qantas flight 2534. 11th of July, Longreach Brisbane, Qantas flight 2535. 11th of July, Brisbane Gladstone, Qantas flight 2346. Then she stayed overnight in Gladstone at the Mercure Hotel. Then on the 12th of July, Gladstone Brisbane, Qantas flight 2331. 12th of July, Brisbane Hervey Bay, Qantas flight 2374. 12th of July, Hervey Bay to Brisbane, Qantas flight 2375. Now we're just working with her to look at where she was and what she did from the 13th of July when she became unwell. So initially she's told us that she essentially stayed at home. So we're just working that through to check that is the case and whether there are any exposure venues. So I would ask anyone in Brisbane to check our website this afternoon when we'll put up exposure venues and we'll put out a press release for where she might have been in Brisbane. Now, we got this information yesterday afternoon, so our Forensic and Scientific Services team worked through the night to do whole genome sequencing, and that came through early this morning. She has the Delta variant, and it is exactly the same as around 60 Delta variants that have been loaded up on the public database. No SNPs different to those 60. They're all the New South Wales cluster. So she's got exactly the same genome sequence as, remember back that Virgin crew member that we had in Brisbane? She doesn't have the same as that 12-year-old boy. So we're not sure at this stage, we're working it through how she's acquired it, but she has acquired the Delta variant that's circulating today in Sydney. Now, we know that is a very, very contagious variant, so that's why I want everyone on those flights immediately tested. Now, they are, quite a while back, 10, 11 days back. So if they're all negative, we'll then have to work that through where else the risk has happened. But it's the same as always. Please, anyone with any symptoms at all, any symptoms at all, anywhere in the state of Queensland, come forward and immediately get tested so we can find people early. Now, those people who live in Longreach, Gladstone or Hervey Bay, it's really important that you come forward and get tested if you have any symptoms. Just be aware. Similarly, we of course are working through with CCTV footage at the Brisbane airport and other airports to see who else this flight attendant might have come into contact with at the airport. But again, anyone at any of those airports, if you've been there on the 11th or the 12th of July, particularly in those areas, Brisbane Airport, it's that bottom area that most of these flights leave from, could you please immediately, any symptoms at all, come forward and get tested. That's critical. So today in Queensland we have 25 active cases, a total of 1,763 cases. I'm becoming reasonably confident about all of our other outbreaks, but we can't be totally confident, so that's why we must continue wearing masks for another week. That is critical, particularly now we've got this latest outbreak that is most likely not related to any of these other outbreaks. It's a new outbreak. So we're just working through how and where this flight attendant, she does travel down into New South Wales, how and where she might have acquired the infection. We did 17,367 tests yesterday, which is a fantastic effort. Thank you to every single person who's come forward and got tested. That's what will keep us safe if people keep on coming forward and get tested. We currently have 5,741 people in quarantine in Queensland across home quarantine and hotel quarantine. It is essential that you follow those rules, please, that you stay in quarantine. Ring 134 COVID if you have any requirements while you're in quarantine, and we'll assist you so you don't need to leave quarantine. Then, as the Acting Premier just mentioned, late last night, the New South Wales rang me, contacted me about Byron Bay, that they've had a positive sewage detection. It's their first one there in a long time. They don't know what the cause of that might be. It could be that they've got a case in the community there. It could be that someone from Sydney's gone up and gone back to Sydney. They're working that through and they're doing increased testing in Byron Bay. This is why it is really important. Only travel into that border zone from Queensland if you really need to, and similarly only travel out of that border zone into Queensland if you really need to. So if it's your normal work or education or to provide care to a vulnerable person, don't travel for discretionary reasons. Thank you.
Well, once again, what this shows us is that we're living in a new norm now with the Delta variant. We are seeing random cases popping up on a regular basis now, and we will continue to do everything to reduce the risk of that occurring and coming into Queensland. But when we do identify it, what we do to reduce that transmission is everybody's responsibility. So the message is clear, and once again this case shows the importance of getting tested early if you have any symptoms whatsoever, but particularly people in Longreach and Hervey Bay and Gladstone, we will have extra testing capacity set up, particularly for all those people who have been on those 6 flights. Also, if you've been at the Brisbane domestic airport on the 11th and 12th, we are also asking you to watch for any symptoms, no matter how mild, come forward and get tested as well. But of course, if you are on those flights, you are a close contact, we require you to get tested, to reach out to Queensland Health and to stay isolated until you've been in quarantine for 14 days from when you were first exposed on that flight, which most of those people will mean only until Sunday or Monday. But it really is important we get the test done and we get those results to see if there is any further transmission whatsoever in Queensland. This also shows that this is not a problem just for South East Queensland. At any point, we can end up someone who has this virus going into our regions. So we need everyone to be vigilant across Queensland. Although we have mandated masks across the 11 LGAs, that doesn't mean you can't wear a mask to keep yourself safe elsewhere in Queensland. And by all means, we encourage you to do so, at least carrying the mask with you at all times. So if you find yourself in a situation where you can't socially distance, make sure you're picking up that mask. Can I just thank the Queensland Police Service with the changes to the border of New South Wales coming in at 1 o'clock this morning. We asked for patience on the road. We know it'll take time for people to get used to the new system again and the declaration system, but we do ask for everyone's patience. We ask for their respect for our officers on the road. They are just doing their job and they're doing it to keep all of us safe. So please remember that. Also, remember to respect all of our staff at our vaccination centres and our testing clinics as well. Even if you are having to wait for a little while, we are all trying to ensure that Queenslanders stay safe, and we thank them for the great work.
Morning. As of 1 a.m. this morning, went to our hard border regime, in particular on our road borders, but also for those arriving at our domestic airports. All of the 3 states now are declared hotspots and various levels of lockdown within those states. So that means 100% screening of everyone coming out of those 3 states, and unless they have an exemption or are a returning Queenslander, they will not be allowed in, and in fact they will be placed into hotel quarantine. As the Minister said quite rightly, now is a time for patience. We have seen, as we expected, every time we go to hard border closures, that there has been delays, there are backups. That will continue. We always know that as we get through this and people get used to the new system, and there has been changes to the border direction, in particular the cross-border direction, people really need to make sure they understand that. As always, anyone that is trying to do the right thing and might get it wrong, we will work with them. But it's very important, if they can get it right before they come to the border, they're going to get through much more quickly. So as that operation unfolds, we'll be updating you in terms of what we're seeing there. Yesterday we handed out 35 masks. So the masks are with us for a bit longer, particularly in the 11 LGAs. Please carry them, please wear them. We really would like not to have to hand out any masks, because that means everyone would be getting that right. We did intercept 1,416 vehicles at our road borders yesterday. 4 were turned around, 1 person placed into quarantine. At our domestic air borders, 1,220 persons processed, 15 refused entry and 100 into quarantine. At our international borders, we saw 170 persons arrive. We did issue 3 penalty infringement notices under the regime for the pandemic, and they all related to heavy freight vehicle operations. And on that heavy vehicle operation, the reminder is there to all freight drivers coming into Queensland that we will continue that operation as part of our hard border closure. So they will still be checked in terms of their compliance. Yesterday, 217 heavy vehicles were intercepted, and we saw a continued improvement, 23 not having the right passes and 6 out of the hotspot. So it is improving. It's still not to 100%, and that's where we want to get it. Thank you.
Sorry, when did she start showing symptoms? When was she tested? And when did it come out positive?
So she started showing symptoms on the 13th of July and got tested on the 21st of July, and it came back yesterday afternoon.
A long time to wait to get tested.
I don't know the specifics of why she decided to delay. That's being discussed with her now.
You said that she had stayed home pretty much for that entire 8
That is what she told our staff. She works on the regional routes, not an international route. Well, we need to go and find out what's happened here and how she's acquired it, and to be able to answer those questions.
She hadn't been to Sydney at all before then?
And she does fly some of those regional routes into New South Wales, so we're looking into that now.
Was she vaccinated?
No.
How many passengers were on board this flight?
I don't have that, but they're those smaller planes that do those regional routes. So all that's being worked through at the moment.
We're talking about hundreds, possibly thousands of contacts in that time for those passengers who are on the flight, they go into their community.
Well, we have to see if they're positive. One issue is that now we're day 10, 11, we'll know straight away whether or not they've been positive, and so whether there's any contacts beyond them.
Will there be further restrictions in regional areas where she's visited?
Well, not until we've tested all of those people and worked out what the risk might be.
We're 18 months into this pandemic. Flight crew are, we know, really at risk of contracting and spreading the virus. Do you think it's acceptable that this person's waited more than a week after developing symptoms to get tested?
I would have far preferred that she got tested on the 13th of July, of course I would have.
How many people, sorry, have you contact traced on those flights so far?
I'm getting all that now. So we only found out yesterday afternoon and immediately got into action. So we're just working all that through now. We'll be able to put it out this afternoon in the press release.
Just on that though, how did Minister Glenn Butcher, how has he already tested negative?
He hasn't been tested negative, he's been tested.
Oh, sorry.
Yeah,
Okay.
yeah.
And where is she now? Is she in hospital? Or?
Yes, in hospital.
Do you have sewage results for all of those areas? Can you test the sewage in Longreach, Harvey Bay and Gloucester?
Yes, we are testing across the state. At this stage, none of those areas have tested positive.
And if people test positive for COVID in those areas, will they be flown to Brisbane? Is there
Yes.
capacity to take care
Yes.
of people in Longreach Hospital, for
No,
example?
no, we will move them to one of our COVID hospitals.
Just to clarify, as for how she contracted it, you're not sure, but it could have been in New South Wales. It's not linked to any existing outbreaks.
Well, her whole genome sequence is identical to around 60 sequences that are loaded on the public database that are in Sydney. So she's definitely part of that Sydney cluster, but we know we've had some cases from that Sydney cluster up here in Brisbane. Now, she isn't linked to the 12-year-old boy and his family that acquired it in Sydney because she's 2 SNPs different. So she's not identical to that 12-year-old boy. She is identical to that Virgin crew member that we had quite a while ago, but that was a while ago, so I doubt she's directly linked. So I'm not sure that we'll ever find the direct epi-link, the direct person that's transmitted to her, but she's clearly part of that Sydney cluster.
Dr. When we had the receptionist at Prince Charles, they'd been in the community for a similar amount of time before getting tested, and you advised that we should go into a lockdown in Brisbane and Townsville. How come we're not going into a lockdown after this test?
Because I need to get some results on those people on those flights, and then I'll make that decision. I don't have enough information at this point to make a decision.
And Dr. Young, with the Byron Bay COVID-19 fragments, could we see a shrinking of the border bubble?
Of course we could. That's why it is absolutely critical that people from the border zone only travel up to Queensland for those essential reasons. If we see people travelling for non-essential reasons, then we'll have to reconsider the border zone.
Dr. just on those 3 areas, those 3 regional areas, Longreach and Harvey Bay, do we know the vaccine rates in those areas and if they're high in the southeast?
I'm sure we do, but I don't have them on me, sorry.
Longreach is very good.
No,
Longreach
of
is very
course.
good.
Yes.
1 in every 2 adults are already vaccinated in Central West Queensland.
There's, just on another note, there's reports this morning of another NRL player breaching the bubble and trying to bring someone into a hotel here in Brisbane. At what point do you say, you know, enough is enough, or what's the threshold for voting them out?
I'm getting very close to it. So yes, I'm very, very concerned about what is happening with these NRL players, and you would have seen that imagery of the family hotel where they were sharing goods between verandas. So I am very concerned.
What is going to be the point that you say enough is enough and get out?
If I have any more breaches,
So 1 more breach and that's
Yep.
it?
yep, I'm very concerned.
Is that for the families or the NRL teams?
It's for all of them, yes. This is too risky. We just cannot have people deliberately breaching the rules.
Question for the acting Premier. We've seen a number of times people waiting a long time before they get tested after showing symptoms. Do you think there needs to be some sort of penalty for people that wait this long and put the community at such risk?
Look, health and police will continue to speak to this individual, and there are penalties that can be applied depending on the circumstances. But ultimately, what's going to work here is not necessarily the penalties, just everybody understanding, absolutely everybody understanding that we have a collective responsibility here, if we are sick, to go and get tested. We've been saying it for a long time. I suppose that could be why people have got a bit complacent, but the risks now are as great as they've ever been, maybe even greater. And so anyone who is sick, any symptoms at all, please go and get tested.
And do you have the number on how many Queenslanders have been fully vaccinated now, not just for Queensland Health, but across all Queensland residents?
Yeah, I can get you the detailed figures, but as I say, we hit 2 million doses this week administered. We need to get to 8.5 million. So we know we've done about 1 in 4 that are eligible at this point. Remembering that, and that's across GPs as well, and we've got our pharmacies and our outreach happening in the regions, and that's why I'm so pleased that Central West hit their target of 1 in 2 eligible adults already being vaccinated, especially in those remote communities, about 4 weeks ago, which is fantastic. But we still need more. So as Dr. Young said yesterday, if you are 60 years old or older, there is enough AstraZeneca out there to come forward and get vaccinated. Don't wait till later in the year. This new strain is highly contagious. It spreads far quicker than what we've seen before. And we cannot afford to wait and see transmission and broad transmission in our community. We don't want to wait to get to a point where New South Wales is right now. So please come forward and get vaccinated if you are eligible and you are 60 plus. We know that we have limited stock of Pfizer, so we'll continue to honour all of those bookings we already have in the system for first doses, and of course anyone who's due for their second dose, and those frontline workers. I've seen that the Commonwealth keeps talking about new priority groups. The reality is it doesn't matter how many people we prioritise, we still don't have the vaccine yet. So we need to get the vaccine into the country in large numbers so we can get people vaccinated, because what we are seeing in New South Wales and the fact that we are seeing half the country locked down right now is very concerning, and we will continue to see new cases pop up, including in Queensland. And the best protection we have is vaccines, so we want to see those vaccines.
Does the Department keep track of the percentage of people in Aboriginal communities who have been vaccinated?
Sorry?
Does the department have data on how many people in
Yeah, because they know what their population, the eligible population, those who are 16 and older, they know their population base and they know how many vaccines they've done. And when we have done regional towns, we haven't gone in and said, well, we're just doing this age group or this priority group. We've gone into a remote town and we've done everyone who's eligible. And I have to say, our take-up rate in the Torres Strait has been incredible, over 70% take-up rate very early on of the vaccination, which is really good. And we know that we've already had 70% of people who are 70 and older have at least 1 dose in Queensland. 60 years and over, we've got about 60%. So, but that means 40% aren't vaccinated yet. So we really want those people coming forward. There's vaccine there, they're eligible for it. We really want people vaccinated as quickly as possible.
You said you're waiting to see the results of those passengers on those flights before deciding on whether lockdown in either which towns. What would it take? Is it 1 passenger on each flight?
I just have to get the information. We've got to remember, though, we've done an enormous amount of testing in Queensland over the last few weeks because of all of our other outbreaks that have been going on. We're up to 10 outbreaks now in Queensland that are still active. So I'd be reasonably comfortable that we've not seen other unlinked cases out there that might be related to this flight attendant. So I just need more information. It's not actually making sense to me that we've got this and we've not had other cases, because we know with the Delta variant, and I've confirmed it is the Delta variant, we know that it usually spreads within 2 days. In Victoria, they're seeing spread from one person to the next in 30 hours. So I would have expected there would have been spread and then spread and then spread. And I've not seen that. So before I want to go and advise about something as momentous as locking down, and we know that we're always prepared to do it and we'll do it fast if we need to do it, I just need a bit more information because it's sort of not quite adding up to me.
A bit weird.
A little bit.
Is it the masks on planes and in air?
Might be. It might be. It could be that this flight attendant has done everything that was required and maintained distance and that there's been good hygiene. I mean, that's why we've got all those plans in place. So yes, it absolutely could be. So if not one single person on any of those 6 flights tests positive today, that would be very reassuring. But then I have to work through what this individual has done since the 13th of July when she's been in Brisbane. So she's only been in Brisbane since the 13th of July. She's not been on any more flights. So then the anxiety will spread to Brisbane as we work out what she's done here.
Dr. Young, do you think the higher vaccination rates in Central West Queensland could be a blessing in disguise in this case?
Of course, any vaccination is good. It's still not high enough to prevent spread, so we really want to see it at that 70-80% level before we'd not see spread. But yes, they have done a really good job.
Sandstone Point Hotel a hotspot? Apparently the owners have been deep cleaning overnight and there's lots of confusion there.
It could be, I don't know, I'm sorry.
Another question from Cairns, where we've been sent some photos this morning of a quarantine hotel there. There's hair on the pillow, mould, dust. It looks quite dirty and they're concerned that it's not properly being cleaned. What checks and measures are in place?
There are a lot, so happy if you send those through to the media team and we can look into them. Thank you.
What would you say to the people in quarantine who have those concerns?
I would like to see those photos, then we can go and find out about what's happened or not happened. That would be very helpful. Thank you.
What sort of checks are in place?
There are a lot of checks in place. As I said, please send me those photos. If you send them to the media team, they'll get them to me. Thank you.
Could I just ask you a couple of questions about UNESCO?
Sure.
Does the Queensland government support the federal government's bid to try to delay the draft decision until 2023?
We're working with the Australian government. We certainly want to see the Great Barrier Reef remain on the World Heritage Register. That's the signal to people right around the world that the reef should be on their bucket list, and there are billions of dollars of our economy, tens of thousands of jobs, reliant directly and indirectly on the Great Barrier Reef. And so we do want it to retain that recognition, but we also want to signal to the global community that we take serious the risks and the threats to the reef. That's what will help the global community be assured that the reef should remain on the World Heritage List. That's why we've suggested to the Australian government that the Reef 2050 plan be released as a draft so that we can signal to them that we will take their feedback on board, that we are willing to add additional measures. We've asked the Commonwealth to consider incorporating in those additional measures additional water quality initiatives, as well as firm steps to address climate change locally, such as investing in renewables projects.
Would a delay be a compromise at all?
Yeah, we've certainly seen that in the past. So in previous rounds, rather than going straight to an in-danger listing, they have put in place a process where they have, for example, sent delegations out, had an iterative process to come to a conclusion. That's basically what happened last time. We were elected in the middle of that process, partway through that process. But I think it started in 2012, 2013, and then had continued over several years. So I think that would be a positive outcome, would allow the Queensland and Australian governments to keep working together, keep putting together a plan that addresses those main threats: climate change, ocean acidification caused by climate change, and water quality runoff.
Last question. Do you know if the Premier will be attending the opening ceremony?
Look, I believe so. We saw that play out yesterday. We saw how important the IOC considers her attendance.
What did you think of John Fraser's comments yesterday afternoon that he needed to fix it?
Look, I think what we saw publicly was a snippet of what had obviously been a more ongoing dialogue between the delegation. I've spoken to the Premier about it. She said that she's not offended. So I think we can all kind of move on. Thank you.
I'm going to go and see my personal position.